Hey guys, welcome back again. We're going to talk about the last little piece that we think is very important for the parents, and it's, hey, what do you do if you're stuck sitting in a little chair all day like I am right now? This chair is designed for somebody that's 3 feet tall. I'm about 6'2", so it creates some problems, right? And it is what it is. We want to play with our kids. We want to be interactive with them. So sometimes we're in a bit of a compromised position in terms of our spinal integrity, right? So we talked about a couple important factors when picking your kids up or holding your kids, and all of it kind of is predicated on spine first. So our principle in mobility WOD is spine first. So we want to think about, now that we know we're going to be maybe in not so great a position, how do we get our spine back into a better position? And the way we're going to do that is through improving the pelvic position. And we're actually going to go after one of the primary hip flexors, which is the Psoas. Okay, so the Psoas starts at the upper portion of the lower back, and it actually goes down and connects into the femur or the thigh bone. So what we see oftentimes is we end up in these kind of flexed positions. What we'll do is, thinking we're doing the right thing, is actually kind of pull ourselves up into this so-called good postural position. But in actuality, what we've ended up doing, if I stand up, I'm really very, very overextended. And that's because when I'm sitting there, I'm taking my psoas and using it as a muscle to actually pull me into an upright position. But because of the attachment point and where it starts, it really just overextends our back. Okay, so that muscle oftentimes can just be activated for very, very long periods of time. Whether you're sitting in a little kid's chair or whether you're sitting in an actual adult's chair, the same thing happens. So we want to do two kind of sliding surface myofascial or fascial techniques to actually get it to loosen up and slide a little bit better. So as always, hey, check out Mobility WOD and Becoming a Supple Leopard for some more in-depth techniques. These are two that I really feel work very well for this muscle and can help get your pelvis in a better position. Okay, so here's what we're going to do. So we got kettlebell today and a lacrosse ball. I'm sure everybody's out there doing the 300 kettlebell swing challenge. My wife's killing it right now, so you probably have a kettlebell handy, and you should always have a lacrosse ball around. It's like the Swiss Army knife for fascial technique tool, so keep that sucker handy. So what we're going to do is we're going to take this kettlebell, we're going to place it on the ground, and the angle of the kettlebell we want to be kind of facing in towards whatever you want to call it, your groin, no man's land, whatever. Make sure it's facing this direction, not the other one. Take my advice, it'll hurt if you do it the wrong way, okay? So put your thumb on the front of your hip and you feel this kind of bony point. Alright, so we want to come just inside of that, maybe an inch or two just inside of that. And that's where the bell is actually going to go. So it's going to look like this. So we're going to lay down on it, going to get some pressure down into that muscle, and in order to let ourselves relax enough, we're actually going to do some contract relax. Okay, so we're going to actually contract the muscle for 5 seconds, really hard. So we're going to squeeze everything, squeeze our stomach, squeeze our butt, 5 seconds, as hard as you can, and then relax. And we're going to relax down for about 10, okay? Now, the other piece that we're going to do, once you've done that for about a minute, is I want you to try to get a minute of movement with your leg in there. So it's a tack and stretch variation, meaning we're going to put pressure down and then we're going to make the muscle either elongate or shorten underneath it. Okay, so we're actually going to bend our leg, straighten it back out, bend our leg, straighten it back out. You can even move your leg side to side and kind of get some rotational movement through the hip in relation to where the psoas attaches. Okay, so that's the first technique. So about 2 minutes there is what we want to do in terms of our minimal effective dose. If you keep making change and it's getting better and better, then do it again for another 2 minutes. Keep going until you're not making change anymore. Okay. The second technique is a little bit more direct. So sometimes we have a hard time getting up where the muscle starts or down where the muscle actually inserts into the thigh bone. So what we can do is we can take that same kettlebell and we can take a lacrosse ball and we can lay down and get it right into that same area. So don't be afraid to come up a little bit higher. Stay below the ribs. If you hit where the ribs are, you're too high. And then down, just on the inside where the point of the hip is where you want to go in terms of further away from the torso. All right, so here's how it's going to be set up. So I want you with your legs bent. Take that ball, find the spot that feels kind of most dysfunctional, and we're actually going to drive the lacrosse ball down in with the kettlebell, okay? So we can do two different things. You can actually roll that ball back and forth, so we can saw the muscle, or, and this is really my favorite one, is to do another tack and stretch variation. So you can add some pressure up towards your chest with the bell, and then straighten your leg out, and then bring it back up, okay? So, again, about 2 minutes. Whatever technique you decide to do, make sure you do it for at least 2 minutes. Pick the one you like the most and stick with it. Try to loosen both sides up. Shouldn't take you more than maximum maybe about 10 minutes total of your time tonight. So go ahead and do that. Loosen your pelvis up and your back will thank you later. Thanks.